This is a review of ultrasound physics. In this segment, we cover ultrasound tissue interactions. Sound energy is attenuated or weakened as it passes through tissue because parts of it are absorbed, refracted, diffracted, or reflected. Sound energy is absorbed when that energy is transferred to the medium or released as heat. Usually, absorption causes most of the sound wave attenuation that is seen in clinical practice. Refraction describes how the direction of a wave can change. This can occur when sound waves pass at a non-perpendicular angle from a medium with one impedance to another medium with a different impedance. A sound wave at a set frequency passes more slowly through a medium with higher impedance. The acoustic impedance of a medium is related to its density and stiffness, or hardness. You may remember from our last review segment that density and stiffness, or hardness, determine the propagation speed. You may also recall from our last review segment that solids have the highest propagation speeds. Therefore, their impedance is the lowest. Gases have the lowest propagation speeds. Therefore, their impedance is highest. In the diagram, the wave passes through an interface at a perpendicular angle to the interface, so the wave path is not changed, even though the speed is different in each medium. Here, sound waves in a medium with low impedance pass through an interface into a medium with high impedance. Since the angle is not perpendicular, the leading portion of the wave on the right will travel slower than the rest of the wave. This, in effect, bends the wave at the interface, resulting in refraction and a new wave path in the medium with higher impedance. Diffraction occurs when a wave encounters an obstacle. In this diagram, the sound wave is completely absorbed by the yellow bar. After a portion of the wave travels through a small interruption of the yellow bar, it is diffracted. The diffracted wave spreads out because the pressures on either side of the exiting wave are low. This is because the pressure or sound energy from the other portions of the wave has been absorbed by the yellow bar. Reflection occurs when a sound wave encounters an interface between two mediums with different impedance. Actually, when a sound wave encounters an impedance interface, some of the wave is reflected and some is transmitted. The intensity of the reflected wave and the transmitted wave depends in part on the difference in impedance. So when sound waves encounter an impedance interface, both refraction and reflection usually occur, as well as some absorption. For a simple interface between two mediums, ultrasound wave behavior can be relatively simple to predict and calculate. However, for complicated interfaces, wave behavior can be very complex, involving attenuation, reflection, and refraction in different directions. Complex reflection, diffraction, and refraction patterns can cause waves to collide. This can cause wave distortion or interference. Constructive interference results in a wave amplitude that is larger than each individual colliding wave. Destructive interference results in a wave amplitude that is smaller than each individual colliding wave. The waves can even be nullified. All of the complex reflection, diffraction, refraction, attenuation, and interference activity, as well as other factors, are important to consider when using ultrasound in clinical practice. All of these factors that affect ultrasound generation, propagation, and detection need to be optimized or minimized depending on the clinical need. So these factors will be reviewed again and will be addressed in later segments on instrumentation and clinical practice. The Doppler effect is demonstrated here. A stationary object, in this case a black square, reflects sound waves as was demonstrated earlier. An object moving toward the source of sound waves, in this case a red square, will reflect the waves in a shorter wavelength and therefore a higher frequency. The Doppler effect will also occur when an object is moving away from the source of sound waves. Then the object reflects waves with a longer wavelength and therefore a lower frequency. In fact, The Doppler effect occurs whenever an object is moving at any angle relative to the source of sound waves, as long as the angle is not perpendicular. Elasticity is the manner in which a material compresses when compressed and the way in which it stretches when pulled. Stiffer or harder materials are less elastic than softer materials. Sound waves can interact with a material as it is being compressed or stretched, causing changes in reflection much like the Doppler effect. The Doppler effect is used in endoscopic ultrasound to demonstrate blood flow and identify vasculature. This will be explained further in subsequent segments. Elastography is being used by some endosonographers to measure how hard an area of tissue is. This will also be explained further in subsequent segments.